a part of me wonders whether alcohol abuse is not perhaps the reason why some of our children get diagnosed with things at an early stage or later on in schools.
Yes, Ilona, that is a reality, and a very good statement that you're making. It is, FASD is firstly a very difficult diagnosis to make, because to diagnose somebody properly, you need a medical examination and specific measurements that needs to be done. So you need a medical specialist who's been specially trained to do this. You need a psychologist to do psychological testing with the child or adult. Remember, this is a lifelong condition, so that you can exclude other type of things that might present with the same signs and symptoms or behavior. And then you need an in-depth interview with the biological mum. So mom needs to tell you what she ate and drank while she was pregnant. She also needs to tell you whether she had any health conditions like preeclampsia, high blood pressure during pregnancy, if she experienced any problems during birth process, so that you can exclude the possible injuries that a child might have sustained during labor. So then only you've made a diagnosis. So sadly, it's our organization is the only center in South Africa who can make this diagnosis. So you will get a doctor who can do maybe the examinations, but she still needs the psychologist and so forth. So that's part of the problem in South Africa, that it's so underdiagnosed. And then for a private practitioner to talk to his or her patient about alcohol use during pregnancy, it's a very sensitive topic, because you might scare your patient off, and your patient might not come back to you thinking that you're accusing her of drinking and so forth. Remember, people don't know all the information that needs to be known about FASD and prenatal alcohol use. And then, so quite often, a more acceptable diagnosis of maybe ADHD is made, because because of what I've explained, FASD is so difficult to diagnose. And also it's more acceptable to say that your child has got FASD. So the stigma around FASD. Wow. So we're still fighting against this thing of people thinking the mum has caused the FASD, where if your child has got ADHD, it's shame, poor mum, you're suffering because of this. And so that's part of the problem. But the reality is also, and please, people who are listening now, and so don't think that if you've got ADHD or your child has got ADHD, I'm saying that your child might have fetal alcohol spectrum disorders. But in our private clinic specifically, we see clients, patients coming in, and they've been treated for years, and they're adults now, for years with ADHD, and in fact they've got a fetal alcohol spectrum disorder, and it was never diagnosed. And then the penny drops off. Oh, this is why I cannot understand the cause and effect of my behavior. This is why abstract thinking is so difficult. This is why I always have these interpersonal relationship problems. This is, so it's a very complex situation. And the stigma is a big, big problem. I'm sure there are people who are wondering, is my child not affected? Is somebody that I know not affected? And affected, and it's very difficult to get to that point to say, okay, I want to get my child tested, because what if? And again, we know reasons why children are born with FASD is that women didn't know they're pregnant, they didn't know about the harmful effects of alcohol, they didn't know about FASD. And I always say, stop blaming, stop stigmatizing. Where were you when your sister was pregnant, or your family member, or your patient was pregnant? So stop blaming. Let's just stand together, raise awareness,
be
make sure that not more children are born.
The stigma thing is what gets to me, and how perhaps our medical profession might not make the effort, because it is much easier to tell your girlfriend that your child has ADHD than fetal alcohol syndrome.
Yeah, it is true. I'm not saying that ADHD is an easier diagnosis
No,
to
it's
make.
not.
But
That's
it's
not what
just
I'm
more,
saying either. No.
yeah. But that's the reality. And stigma, you can talk about stigma till
For days.
yeah, because self-stigmatization, stigmatization of the family, because if I've got FASD, what about my siblings? You know, those type of things. So it's quite a ripple effect that if you go for testing and so that it might have on the family.
Quite hurtful, right?
Yes, scary.